Counselling Mood Disorders and Depression. Introduction to the module. This module will look at the possible causes for mood disorders and depression, along with counseling techniques and other methods which can be used in their treatment. Topics to be covered in this module: mood, mood disorder, depression, bipolar disorder, major depressive disorder, MDD. Mood. Mood can be difficult to define, but is generally considered as the transient mindset from which people approach life events. The mood can transition from positive to negative reasonably quickly. The environment is thought to have some impact on mood. It does not always account for it, however. A person can be in a good mood despite unpleasant events. At another time, the same person might experience a bad mood despite pleasant events. Mood disorder. Mood disorders occur when normal mood patterns are disrupted. They can lead to manic behavior, hypomanic behavior, and major depressive episodes. Manic behavior is caused by high frustration and leads to lack of control. Hypomanic means that an individual is hyperactive but in control. Depressive means someone is disinterested in life and normal activities. It reduces a person's ability to control themselves and can potentially cause violence episodes. Depression. Depression is a long-lasting low mood. It can vary from mild to extreme. In mild cases, depression can cause tasks to feel pointless and much more difficult than they would otherwise seem. In more extreme cases, depression can cause suicidal thoughts and even suicide. It is a dangerous condition which needs proper treatment and attention. There are several types of depression, including bipolar disorder, manic depression, postnatal depression, and seasonal affective disorder, SAD. Causes. Depression can be triggered by many different things. A major loss, for example, death of a loved one, may trigger it. Other life-changing events, such as having a baby, can also contribute. The event does not necessarily need to be considered a sad or negative experience. It is believed that depression might have genetic links, as it can often be traced through families. Symptoms. Depression has many different symptoms. Some are physical and some mental. If you are suffering from depression, you may feel persistently low, feel unhappy or hopeless, lose interest in activities which you previously enjoyed, suffer from anxiety, feel constantly tired, suffer from poor sleep, lack of appetite, lack of sex drive, suffer from aches and pains with no clear cause. Forms of treatment. Treating depression is complicated and often requires several approaches to be effective. Mild depression can sometimes be treated by waiting for symptoms to improve. This is usually combined with improving physical health. Counseling can be extremely useful if symptoms don't improve or depression is more serious. Cognitive behavioral therapy, CBT, can help patients talk through issues. Self-help groups and medication are other options. Antidepressants may be prescribed in some cases. Bipolar disorder. A person suffering from bipolar disorder will experience severe mood swings. These are often manic and depressive. A manic mood is characterized by agitation, irritation, and psychotic features. A hypomanic mood is less intense and will not include psychotic features. A depressive mood means the individual will show signs of depression. Mood swings can occur in quick succession. People can also experience periods of exacerbation and stability. Causes. It is currently unclear what causes bipolar disorder. Some researchers believe it is genetic, as first-degree relatives often suffer from it as well. Others think that bipolar disorder is the result of abnormalities in the neurotransmitters and neuroreceptors. Some researchers believe that bipolar disorder can be worsened by environmental factors. These might include stress and exhaustion. However, attacks often begin without any clear triggers. Symptoms. The symptoms of a depressive episode include hopelessness, insomnia, isolation from others, lethargy, feeling overwhelmed, low self-esteem. The symptoms of a manic episode include agitation, sense of superiority, impaired judgment, impulsive behavior, delusions, high irritation, paranoia, problems sleeping, poor appetite. Individuals may move between depressive and manic episodes quickly. Forms of treatment. Bipolar disorder can vary in severity, and treatment may need to be tailored to suit the individual's challenges. Without treatment, manic episodes can last for 3 to 6 months, while depressive episodes can last 6 to 12 months. Treatments include counseling that helps greatly with depression, improving lifestyle such as sleeping and exercising more, medication to treat symptoms when they occur, mood stabilizers to be taken daily in the long term, learning to recognize triggers. Major depressive disorder, MDD. Major depressive disorder is the result of an individual experiencing depressive symptoms for 2 weeks or more. It can be very disruptive and prevent them from dealing with everyday situations and routines. Many people may not even realize they are suffering from MDD and may not seek treatment as a result. Episodes of MDD often increase as the person gets older. Causes. It's unclear what causes MDD. Some researchers believe there may be a genetic predisposition and that multiple genes can influence it. High stress is thought to increase MDD, or at least its symptoms. It is thought that the hypothalamic pituitary adrenal system may affect MDD. There have also been some links made with abnormal cortisol levels. Symptoms. MDD is often characterized by some of the following symptoms. Remember that not all symptoms must be present for a person to be suffering from MDD. Apathetic behavior, low self-esteem, thoughts of suicide, sluggishness, insomnia, changes in appetite, sexual dysfunction, sense of hopelessness. Someone suffering from MDD may also struggle to focus and might lose interest in activities they previously enjoyed. Common test results. For MDD to be diagnosed, patients must show 5 of the following symptoms for more than 2 weeks. Feeling worthless. Depressed mood. Inability to concentrate. Weight fluctuation. Fatigue. Insomnia. Disinterest in daily activities. Agitated or retarded movements. Forms of treatment. Episodes of MDD can be long-lasting, though the individual may go months without experiencing symptoms. Potential treatments for MDD include atypical antidepressants, such as mirtazapine, nifazodone, trazodone, and bupropion. Tricyclic antidepressants, such as doxepin, amitriptyline, and tofranil. Selective serotonin reuptake inhibitors, such as Effexor, paroxetine, fluvoxamine, citalopram, and sertraline. Monoamine oxidase inhibitors, such as Parnate and Nardil. Counselling will often be used alongside medication to help a person cope with the symptoms. Electroconvulsive therapy. This involves applying a small electrical current to the brain while under anesthetic. It causes 30 to 60-second seizures. It's given 3 times a week for 6 weeks. This is usually an alternative when medication has failed. Summary. The following topics have been covered in this module. Mood is the mindset from which people approach day-to-day life. There are various types of mood disorder, which can lead to hypomanic or manic behavior and periods of depression. Depression is characterized by long-lasting low mood and treated through therapy and medication. Bipolar disorder is characterized by major mood swings and usually treated through talking therapy, lifestyle improvements, and medication. Major depressive disorder is the result of lasting depressive symptoms. It is usually treated through antidepressants, certain inhibitors, counseling, and sometimes electroconvulsive therapy.